This is the part 2 video for reasons why you might be having hip flexor tightness, and I'm going to talk about different chemical stressors that could be causing that. So when we think about the hip flexors, we have to think about the nerve root, and the nerve root that controls the muscles, right? And that nerve root also controls an organ in the body. This is true for any muscle and organ connection. So we want to think about what organ is also being controlled by the L1 to L3 nerve levels. And that would be the kidneys and adrenal glands. So I see this very commonly, especially when someone has been strengthening and lengthening their hip flexors. Mainly they're trying to stretch them over and over and there's no relief. And if they are someone who is chronically pushing themselves, like athletes, so this is very common in athletes, and they have an excess need for cortisol production, because cortisol is what gets our blood pressure raised and our heart pumping. It increases blood glucose levels, which will then push the glucose into the muscles so that we're ready to run away from something. So it's something that we need to survive and to perform at a high level. So if you are someone who has a constant need for cortisol production and your adrenal glands secrete cortisol, then you may have some sort of inflammation, or I'll say imbalance, at that gland or organ. It works the same for all this. So if that happens, then you can get an inflammatory response at that nerve root, which causes abnormal functioning and signaling to the associated muscles. Okay? So I want you to think about that. And what are some things that raise our cortisol levels? Excess stimulants in general, right? I just said anything that gets us ready for action. So when we go and exercise, we have a need for cortisol. That doesn't mean don't exercise. It just means we need to support ourselves properly. So excess stimulants. So some of my athletes who also take Adderall, or my hardworking professionals who also take Adderall for focus, that can screw up this system a bit and these hormones. If you drink a lot of caffeine, if you have a lot of inflammatory processed foods, if you are dealing with a pretty traumatic event that caused your body to go into stress, like maybe a car accident, maybe you were pregnant and then you just gave birth, and that surge of hormones and then that depletion of hormones after may have caused your low back pain due to these hip flexors being tight, right? Because of where the hip flexors attach. So I want you to just think about this. This isn't a definite, this is just another idea if you're someone who has been dealing with chronic or inflexible hips, right? Hip tightness. So ways to support: vitamin C, super crucial. Your adrenal glands house the majority of vitamin C within them. You want to take maybe things like adaptogens. So adaptogens are things that help your body adapt to stresses put on it. So things like holy basil, rhodiola, licorice root, ashwagandha. There are more. Any sort of adaptogens, you can just look that up. Sometimes there's such a deficiency that you may need a different type of support. Like, let's say you've had your hormones tested and you're bottomed out on all your hormone levels, you're low on everything, then you might need to look into taking some sort of glandular support to help have your body bounce back. I would highly recommend working with a practitioner for that one. I wouldn't just try to go find these types of supports and dose them yourselves, but I wanted to give you this idea so that you have an open mind for other reasons why you could be having this chronic hip flexor tightness.